plans like that. And now patients really need a reason to stay in your practice because it's, they become, I think, more educated consumers, and they're out looking and shopping in dentistry, and we need reasons to be able to keep our patients in our practice. And looking a little farther down the road, we're really headed toward a preventive, and I'd rather call it a wellness model of dentistry. Reimbursement is going to be based on outcomes. I mean, I spent a lot of time in the dental insurance industry with the leaders in that industry, and that's where they're headed. And patients are going to need a lot of reasons to stay in your practice as we go farther ahead. So that's really what I'm seeing, coming down, and actually here's the slide from that paper from December in Inside Dentistry. And I encourage you, if you have that, in your office, maybe just take a look at that, because it really kind of is a very cogent description of where we've been and kind of where we're headed, the road ahead. And then this was in December as well. The ADA Morning Huddle. It's a mobile app that you can get an email every day, and they highlight some main topic in dentistry. And I thought this one was very appropriate. Americans, dentists, are feeling disappointed by the shortcomings of the Affordable Care Act. For by and large, we've kind of been cut out of that deal. And so while parents are required to provide dental insurance for their children, adults are really getting the short end of the stick, and that's putting a lot more pressure on you and me in our practices as well. So it's really the focus of the healthcare system is on making sure that people have medical insurance at the cost probably of having good dental insurance. So when we look at then, I mentioned previously the utilization of dental care by adults in the United States. It really peaked in about 2002, and that's when 60% of the patients in the United States had some type of dental insurance or provider or employer-provided reimbursement program, and it's been on a steady decline. I think that curve is going to get steeper in the next 5 years as the Affordable Care Act continues to be implemented, and the cost for that insurance and all of those insurance programs continue to rise. There's going to be increased pressure on employers. And when we look then at dentistry as a whole, as part of the health profession, when you look at the total healthcare dollars spent in healthcare, it's declining a little bit, but dentistry actually in the last 6 or 7 years, we're in negative growth. We're actually shrinking. There's fewer dollars being spent now than there was in 2008 on dentistry. So instead of increasing, just this gradual, slow increase in terms of dollars spent on dentistry in the profession, it's actually shrinking. So while all these other factors are going on around us, it's getting more competitive as we're competing for fewer and fewer dollars that people are spending on their dental health. This was a survey that was published about a year ago in JADA, and I found it was interesting. And they looked at looking at community factors predicting dental care utilization amongst older adults. And so most of the people in this study were over the age of 60. But, when you look at that segment of our population, the things that contributed to them actually seeing a dentist were individual factors, like if they were, a woman, if they were married, if they had, they were in a higher socioeconomic bracket, if they had an advanced education level, and if they were living in a community where there was a higher dentist to population ratio, they were more likely to see a dentist. So, we know what these utilization rates look like for different demographics within, our population. One of the things that I think the Affordable Care Act promised was that it would take some of the pressure off of the emergency room visits that occur. That was kind of like the primary provider for a lot of people that didn't have medical insurance, and it has also been kind of the primary provider for people who didn't have dental insurance and were in dental pain, acute dental pain. And when we look at medical room or emergency room visits then for dental procedures, dental emergencies, it only accounts for about 1% of the total emergency room visits, but and about 70% of those people were either on Medicaid or they didn't have dental insurance. So, this is the population that's going to go to the emergency room. The challenge for us in the entire system is this is the most expensive health care on the planet. Just an exam in the emergency room for a dental emergency, typically probably an abscess tooth, the patient's in pain, they don't even take a radiograph there. Typically, they just do an oral exam and they write them a prescription for antibiotics and pain medication, and the cost of that is $760. Now, that burdens our entire system, and you and I end up not getting those dollars in our own practice, and I know in your practice it doesn't cost $760 for an emergency exam and an x-ray and for you to write a prescription. So we need to become more efficient and better utilize our health services, and particularly in dentistry. When we look at patients that see the dentist or have dental insurance, like I said, it peaked in 2002. It's on a steady decline. One thing we know about patients is that, and this actually comes from Delta Dental, these statistics, and they're the largest dental insurance provider in the country, so this is really good data. But 81% of the people who have insurance see a dentist twice a year. Of the patients that don't have dental insurance, only 34% of them see a dentist twice a year. So what we're looking at is patients in your practice that are in that 81% pool. 81% of them come to see you twice a year. If they lose their dental insurance benefits, they're going to shift into that 34% pool, where only literally the patients that lose their dental insurance, only a third of them are going to continue to come to see you. And I can tell you that I was, probably in the mid-1980s, a large employer in town was sold, and there was a union holdout on a contract, and a lot of my patients lost their dental insurance, and for a period of a couple of years, and literally they didn't come see me. I mean, they were gone. And if they had a toothache or something broke, they came in. But beyond that, they didn't come in to see us for their regular care. So I know that that's a valid data point, and I think that's a concern for us, particularly if we look at the Affordable Care Act and we talk about a significant number of our patients losing their dental insurance, say, in the next 5 years. And I thought there were two data points that they cited. Number one was 44% of them said the reason we didn't go see the dentist is because we don't have dental insurance, and the second most common cited reason was because it's too expensive. And so, those kind of, whether the perception is reality or not, those two things kind of go hand in hand, and if that is their perception, that is the reality, and so they really don't think that they have access to care. So if you don't have an option available for your patients as we go through this, change in the next few years, you're literally my concern for my own practice, and my fear for you is that you're going to see a significant number of your patients maybe shift from that 81% pool down to the 34%. And I don't know if you've experienced that in your practice. I don't know if you've had these conversations. It seems like every day I have a conversation with a patient who is either just retiring, just lost their dental insurance, or is about to lose their dental insurance, and they're panicked. And they're asking me, what do I do? What am I going to do? Where am I going to find dental insurance? And individual dental insurance doesn't really make sense for the average person. You actually pay more for the benefit than the benefit provides, you significantly more. And so it really doesn't make sense for the average person. It provides a safety net, but at the same point in time, let's see if we can provide a better kind of program for that patient. So there's a real opportunity here for us. I thought it was very interesting when those patients who have lost their dental insurance, and they were asked the question, if you lost your dental insurance, would you buy it yourself? And, and literally about 75% of the patients said, yeah, if I lost my dental insurance, I want to replace it. And then the next question they asked was, well, if you replaced it, would you replace it with a premium program like you have now, or what kind of plan would you look for? And literally 75% of the patients, the same demographic, said, well, we'd really rather have a lower price preventive-only plan. We really want to make sure we take care of our prevention and our wellness. That's job number one, or interest number one for us. So I thought that, that was a very interesting demographic to share with you as well. So as we look at, this is kind of the landscape that we're working in. It's, there's more financial pressure on us. There's more challenges with patients losing their dental insurance and, trying to figure out how they're going to continue to be able to afford and have access to care. I think new patient flow certainly has been a challenge, I think, for every dentist I get a chance to talk to. They see that new patient flow isn't what it used to be, and it's getting harder and harder and more competitive. And I think one of the things you're seeing, the corporatization of dentistry as well. We're seeing a lot of large corporate organizations buying up small dental practices in towns. I think we have 5 or 6 corporate practices now in Albany, Oregon, and literally, 15 years ago we had none. So patients go there thinking they're getting a better deal when in reality that's not what I've observed from my own personal experience. So anyway, but that's a challenge for us private practitioners as well. There's 2 more data points I want to share with you tonight. So we have this changing economic environment in the United States, and again, I really think it was changing already, but it really has been precipitated by the Affordable Care Act. The things that the other 2 points I want to bring to your attention is, so while that's going on, at the same time, dental caries is growing. It's the #1 disease in the world. Of the 291 diseases tracked by the World Health Organization known to man, dental caries is #1. And it's literally #1 in every country, and it's literally #1 in every age demographic in every country on the planet. And China, I think, holds the record there. Literally 100% of people in China have active untreated decay statistically, by survey in their mouth. But it's #1 in the United States as well, and it's #1 in children. For the first time, the last CDC report, actually in the last 16 years, we saw it's kind of the dental caries rate on our 0 to 5-year-old children in the United States finally has peaked, and it seems to be leveling off. So I know that you deal with these same issues, particularly with senior patients who are, have medication-induced xerostomia, and we have all this, increasing amounts of disease we're trying to treat on a system that has fewer dollars to share and less access for our patients. So that, we're kind of caught in the middle, and there's a squeeze there. The other thing that I would share with you is this is the Dunedin cohort study. In Dunedin, New Zealand, it's on the South Island. It's a small town. And they started this study back in 1972, and they took all the children born over a 2-year period of time, which turned out to be 1,037 kids, and they've been following them for their entire lifetime. So these kids now are 42, 43 years old, and they've been they've been following them. They've been measuring all kinds of data about them with all of their overall health, not just dentistry, but their entire overall health. In the dental area, the thing that's most interesting to me is that they've been seeing them at age 5, 9, 15, 18, 26, and the last time was age 38, which they figured to be about midlife. And in New Zealand, they have government-provided dental care in the schools up through about up through high school. And at that point in time, then there is no private dental insurance. It's really fee-for-service. And interestingly enough, they have about the same statistics that we do. About 50% of the population there see a dentist twice a year, and about 50% don't. But when you look at this cohort, this group of people, and there's still almost about 900 people still participating in it, because people kind of are born there, don't really move away. So it's really a unique opportunity for us to study a population, and I would tell you their healthcare, their diets, et cetera, what have you, are fairly typical of, are fairly close to Americans. The American diet has changed, but for the most part, I think that we can rely on this data. The interesting thing is that their decay rate has not changed. And so traditional dentistry, which is what they've received both as a child and then half of them as adults in that area, traditional restorative dentistry in New Zealand has had no effect on the decay incidence, the caries incidence of that population. If you were low risk for dental caries when you were very young as a child, you tend to still be low risk as an adult at age 38. If you are moderate risk, you're still moderate risk. If you're high risk, you're still high risk. So in spite of everything that we do in traditional restorative dentistry, hasn't made an impact on the decay rate in this population over 38 years of their life to this point. They're going to continue to study them for another 40 years. So we've got 2 data points there. Number one, we've got a growing, it's the #1 disease in the world, and what we've been doing isn't working. It's not changing that decay rate. So we really need to move and think wellness and move toward a wellness model. And we've got these economic pressures and, on us as well, as those things are changing our profession. And so the question becomes, how are we going to solve this problem? And, one of the questions, I think you need to think about is like, well, why would you do this? Is it better for your patients? Is it better for your practice? Is it better for you? So Heather, kind of giving that background of the state of the profession, let me turn this over to you and let you kind of go through in detail, the dental wellness plans that we've come up with.
Okay, thank you, Kim, and what great information regarding what is currently happening with dental insurance today. My plan is to show you all a solution that we have, which is called Compass. Compass is a membership program directly between you and your patient. Our goal with Compass is to put the patients, like Kim said, put the patients and the practice back in control. First and foremost, it's important to emphasize that Compass is not insurance. So take a moment and think about what the conversation would be like when a patient comes to you and doesn't have insurance. What options do you have for them? With Compass, you can offer them a dental wellness and loyalty program. For a small monthly fee, patients will receive all of their necessary preventative services along with a loyalty discount on restorative or cosmetic procedures. So a simple comparison is the gym membership. By paying one small monthly fee, the average gym membership allows you to have access to the gym and their equipment, as well as a discount on things such as supplements, tanning, or personal training. And usually there's something free, such as your first month or that personal training session. So Compass has a similar concept. With Compass, your patient is going to be a member of your practice. With a monthly payment, patients are going to receive basic preventative services, such as dental cleanings, exams, x-rays, and an emergency exam if needed. And included with this is the added benefit of a 15% savings on all other dental services, such as whitening or cosmetic work, as well as a smile consultation. So within the Compass program, as you can see, there are 3 different wellness plans for you to offer. You have the option of choosing whether or not you offer one plan or all 3. So I'll take a moment to go over what makes each plan unique. The wellness plan, which is the one that you see in the middle, it's our most popular and standard plan. Patients who choose this plan will receive 2 cleanings per year, 1 to 2 exams, along with an emergency exam if needed. There are required x-rays, and patients will have a 15% savings on other dental services and the option of a smile consultation. The one thing about the smile consultation is it's a great opportunity for you to have a conversation with your patient about what they want and what they envision long term when it comes to their smile. The Kids Wellness Plan on the left is a similar plan, but in this case it includes a fluoride treatment. And the Perio Wellness Plan offers 3 to 4 cleanings versus 2. We also offer the unique ability to send prescription dental products to your patients quarterly, and this is an optional add-on for the dentist and patient. So those are the 3 plans that we have and that you can offer. Now let's review some of the basics on how offering the Compass plans work. The best part with the plans and the program is that you are able to make some basic decisions on how Compass will work in your practice. There are 5 different price levels that you can choose from. This will determine the patient's monthly fee and your compensation. This way you can align the price level with your current fees. You're also able to set any exclusions you would like for the 15% savings I mentioned, such as what cosmetic and restorative procedures it applies to. Having the option to choose exclusions and what plans to offer really puts your practice in control. In this case, there's no third-party influence. For example, you don't have to send in any pre-authorizations or codes, and this really is a huge benefit of Compass not being dental insurance. When it comes to us, we will take care of the basic behind-the-scenes process to take the extra work off of your shoulders. Your patient's payments will be set up automatically and processed by us, and we will send the payments to the practice on the 15th of each month for the patients that you have signed up. We also provide an experienced marketing team to help support your membership plan growth, which I will discuss more in a moment. Our goal is to assist you in securing your patients. They're now members of your practice. Compass allows you to build long-term relationships with those members. Case acceptance will increase, and patients will be much more likely to move forward with the treatment plans when they have the added benefit of that 15% savings. By giving your patients a month-to-month option, it's more affordable for them, which will increase the fee-for-service patients. And as Kim mentioned, there is a growing amount of patients without dental insurance, and this will be a huge marketing point for new patients. So when it comes to getting started with Compass, it's very easy. After visiting our website and reviewing the different plans and pricing, you can sign up to become a provider. From there, a custom web page is created for your practice showing information and the plans and pricing that you choose. After that, a code is generated, and this code will allow you to add a button onto your site linking directly to this page. So once you've installed that, you're ready to begin signing up your patients, and you can become a provider in just a matter of minutes. I'll go ahead and show you what this process looks like so you can have a visual. Once you arrive at compassdentist.com, you'll see Become a Provider in the top right-hand corner. After you click that, a pop-up will appear, which will ask for some basic information, including your name, phone number, and email address. The next page is where you're able to review our plans and our price levels and decide which one will be the best fit in your practice. As you can see, there's 5 different price levels to choose from, like I mentioned earlier, and with that, there's a sliding percentage scale. So when it comes to pricing and compensation, we really want this to be a partnership. The more patients that you sign up, the lower your the more patients that you sign up with Compass, the lower your fees will be. So with the sliding percentage scale, it starts at 12.5% and goes down as low as 7.5%. While you're on this page, I recommend visiting other parts of our website, such as the FAQ page and the resource page as well. From there, once you've chosen the plans and the price levels and are ready to move forward, there's just one last section where you create a profile for your practice. During this process, there will be a one-time activation fee of $795. Once this is completed, you are now a provider, and it will lead you straight to your account. One of the first things you'll see in your new account is a reminder to add the button to your website. This will be the easiest way for patients to sign up outside of the office. Let me show you an example of an office who has added the button to their website. This is Dr. Lawrence in California, and Dr. Lawrence's office added the Compass button to their sidebar. This will really stand out to patients who visit her website, and from there they can sign up directly with her practice just by clicking on it. I mentioned earlier that we have a skilled marketing team, and at Compass, like I said, once again, this really is a partnership, and it's our job to make sure that this program is successful for you and your practice. We have a number of marketing tools and options that we provide, as well as a tremendous amount of marketing support, and we're only successful if we make sure that you're successful. So when you're ready for marketing help, reach out to us, and we can help you with that. Compass is also testing a co-op marketing opportunity to help bring in new patients, so we hope to be offering that to practices in the near future. So now that I've reviewed the basics on how the program works and how to sign up, let's go over why you would do something like this in your practice. The primary reason patients avoid the dentist is lack of insurance. By offering an in-house membership plan as an alternative to insurance directly through the practice, dental professionals are addressing the primary barrier to increasing new patient flow and practice growth. The next reason is it sticks. By making small monthly payments for the membership plan, their dental membership quickly becomes a habitual part of their monthly expenses rather than an unexpected or unbudgeted variable cost. This allows the dental practice to really build a patient base with a membership mentality that will increase patient retention and secure patients to their practice for life. Compass can be sold anywhere at any time. Dental practices often lose potential new patients simply due to availability. By offering a monthly membership plan on the practice website, it can be purchased by new or existing patients at any time. Rather than giving a potential new patient a business card or telling them to call the practice during business hours, patients can go straight to your website and sign up immediately. the entire dental team can, in effect, become full-time sales ambassadors for the dental practice. This is also very important when it comes to ROI and marketing endeavors. Whether using social media, mailers, or other media forms, new uninsured patients may want to join the practice on their own time. So instead of a call of action of filling out a website contact form or call during business hours, these patients can purchase a membership through the website immediately. It puts the responsibility of the appointment on the patient. A membership plan also creates a very smart psychological change in the business dynamics between the dental practice and the patients. Hygiene appointments are very important in any practice. Instead of chasing existing patients with or without standard dental insurance with mailers, phone calls, texts, and emails to make and maintain their hygiene appointments, membership plans really put the responsibility of maintaining appointments on the patient rather than the practice. While it's recommended to notify patients of their lapse in dental care, the patient's membership dues are being paid automatically to the practice. And if the patient chooses not to make and maintain their appointments, the financial consequences are already built into this membership plan. An average of 18% of patients who have coverage for preventative care do not go to the dentist twice a year. Instead of an insurance company reaping their financial benefits, it goes to the practice where it belongs. And lastly, independence and control. One of the biggest issues dental practices that are dependent on insurance patients face is the lack of control over fees and payments from dental insurance companies. With our wellness plans, the practice sets the prices, fees, and exclusions for any discounted services, putting them in control of their own revenues. As the number of uninsured patients continue to decrease and costs continue to rise, dental insurance companies are putting the pressure on the practice providers in order to maintain their revenues. By building an independent membership base, practices begin to build a more secure future. So those are some great reasons why to do Compass and why to do a membership plan in your practice. And that's the information I have for you today about Compass. At this point, some of you may be thinking that you're ready to become a provider, and others might want to spend some more time looking over our website and our FAQ page. But either way, when you're ready, I would love for you to give me a call so I can answer any questions that you have and also tell you about a great discount code we have off the activation fee during the month of January. So there's just a couple weeks left in January. I'd love to tell you about that code and the offer I have. I'll be here the rest of this week from 8 a.m. to 4 p.m. Pacific time. And the phone number that you can reach me at is 855-272-9581. I look forward to hearing from all of you and helping you become successful with Compass. And Kim, was there anything else that you wanted to add at the end of this?
Oh, I tell you, Heather, there's so much. I was sitting here listening to your presentation, and there's so much that I could add. I would just tell you that I've been overwhelmed in my own practice by the response from patients and new patients that we're getting. Typically, I mean, every time I turn around, we're getting another person that signed up for Compass. And one of the things that you said that that kind of struck a note for me was, you know, new patients can sign up in the evening. And we've had this happen numerous times where, you know, patients in an evening time, yeah, I want to do this, and they go, and people that we didn't, you know, I don't know how they found us other than through our, you know, the Compass marketing we've done, and they're going on and doing this at 7 or 8 o'clock at night. So while other dental practitioners aren't in their office answering the phone, you know, I'm getting new patients signing up for my practice and a plan that makes sense for them, you know, on their own time in the evening when, you know, we're not at the office. So that's really exciting to me. You know, when we first started this, my whole vision on this was that we really needed to help all of us retain our patients as we go through this Affordable Care Act and the change in our healthcare system in the United States. And what's really happened in the last, you know, 12 months as we beta tested this is really an incredible new patient tool. I mean, you've got half of the population, you know, of our population that don't regularly see a dentist. And, you know, I've been a dentist now for 36 years, and 50% of the people in the United States went to the dentist when I graduated from dental school, and 50% of the people in the United States go to a dentist now on a regular basis, right? And so in the 36 years of my career, we've never been able to answer or solve or penetrate that other half of the market. And I think for the first time, this gives us an opportunity to be competitive and attract those patients. The reason they're not seeing us because they don't think they can afford it. They don't feel they have access because they don't have dental insurance. And now we have a solution for them. And I think it's the first time in my career that I'm excited. I think that we have a solution and we have an answer to attract this other 50% of the population. I mean, half of our market is available to us if we could just figure out how to make their access easier and more affordable for them. So I'm really excited about that. Heather, it's been an exciting time, and I really hope that you all take a good consideration because the impact I've seen that this has made in my practice, I'm excited for 2015. So anyway, I just that's it for me, Heather.
Yeah, I completely agree with you as well, and thank you everyone for joining us tonight. As a reminder, any questions that we didn't get to or answer tonight, I will follow up with tomorrow. Have a good evening.
Good night, everybody. Thank you for joining us.